the effects of anxiety on the sympathetic nervous system and the vascular system. So our hypothesis is that people with anxiety have higher sympathetic activity, and that leads to vascular dysfunction, either poor blood flow or endothelial function in the periphery, or a stiffening of the large arteries, the carotid and the aorta. And so we measure sympathetic activity using a technique called microneurography. And that takes a small microelectrode and you put it through the skin into the perineal nerve right above the fibula head. And from that we can record the sympathetic nerve activity bursts. And we can count them. And so we can actually quantify how much sympathetic activity the patient has at rest. Then we can stimulate them by either putting their hand in cold water for 2 minutes, which increases the sympathetic activity, or we can do mental math where we have to read, for 4 minutes they have to read, answer some arithmetic or simple math questions as fast as they can. And so that stimulates sympathetic activity as well. So we're starting to see some differences in the responses in the sympathetic activity and the vascular function with anxiety, people with anxiety. So we don't see the changes so much at rest, but when you stimulate them, there may be some differences. So we haven't published that yet. We're still analyzing the data and recruiting more patients, but that's the sort of the main finding. And the second thing we're doing is an intervention where we do the ACT. So this is acceptance commitment therapy or training. And this is where they do a one-day workshop on anxiety, how to tools to reduce their anxiety. And then we follow them for 12 weeks. And then we retest them at the end to see if the intervention, which lowers anxiety, if that improves their vascular function and lowers the sympathetic activity.
But in your experience, when the patients take the therapy pharmacological, there is a stabilization of hyperactivity, sympathetic hyperactivity. Do you have experience in this?
In what now?
Do you have experience in which the pharmacological therapy stabilizes
No, I
the
don't.
hyperactivity?
I don't know that. Some of the patients we study are on some of the anti-anxiety medications already. Some of them are not. That'd be something that Dr. Fedorowicz could. So I don't know what its effects are on the sympathetic activity. I'm not sure.
How many patients you see?
I might see some of these patients that already have cardiovascular disease, but in the study we're doing now, we exclude those patients for now.
Yeah, but do you have the patients that you see go in cardiovascular disease or no? In your experience?
No, I don't know. Well, the literature shows there's a higher risk, but we don't follow the patients long enough to know. Most of the patients with anxiety we're studying are fairly young, so they're in their 20s and 30s or 40. So we don't see a lot of older patients. So most of them don't have cardiovascular disease, or we don't follow them long enough to determine whether they get it. So we're not sure.
Okay, thank you.
Yeah, sure. They're doing a study in there right now with patients. So let's go over. Let me see if we can take a peek in.